Thank you very much, Christina. It's wonderful to have you on the team. You're a delight. It's great to have you being so much involved in this particular program. And thank you for your kind words of introduction. And I also would like to thank my wife, Sue Ann Thompson, and my daughter, Tommy Thompson, who are both with me today from Wisconsin. So I appreciate them very much for coming from Wisconsin to be here for this Red Dress Day. And let me also thank the fine Americans who have joined me here to spread the message about women's heart health. I'm proud to declare this day, and the third Friday in every February, as Women's Heart Day. And I'm also very happy that David J. Markowitz, who is here representing the American Heart Foundation, and thank you very much, David. Only criticism I have of you is the fact I don't see any red on you whatsoever. But other than that, I thank you so very much for coming here today. It's a great historic connection. And there is a very great historic connection between fashion and women's health. Back in 1943, when the Public Health Service formed the Volunteer Nurses Corps, a full fashion show was held at the Waldorf Astoria in New York City in order to choose the nurses' uniforms and encourage more women at that time to become nurses. Of course, this building will never be confused with the Waldorf Astoria. But it's wonderful for me to have this opportunity to join each and every one of you today to celebrate the arrival of the red dresses at this wonderful department of HHS. This outstanding project will do more than just show us the prowess of our best fashion designers. It will save lives. But these dresses are beautiful, and we hope that everybody that sees a red dress will start thinking about women's health and taking care of women's hearts. And as part of the Heart Truth campaign, these dresses are going to travel across the country, bringing the message of women's heart health to millions of Americans. And it's such an important message, my friends. Women are too often tragically unaware of the danger of cardiovascular and heart disease. Some people think heart disease is just a man's disease, but in fact, it's the #1 killer of women in America. Just look at this chart over here. 366,000 women died last year of heart disease. Since 1984, heart disease has killed more women than men. This is a little-known fact, but it's true. Every year, almost 500,000, this past year, 366,000 Americans of our mothers, our sisters, our daughters, and our friends die from it. 2/3 of American women who have had a heart attack don't fully recover. And only 1/3 of American women are aware that heart disease is the greatest threat to themselves. Only 1/3 of the women in America today. It's time to act. It's time to get the word out about women's heart health. And that's why this department's National Heart, Lung, and Blood Institute is cooperating with luminaries of the fashion and design industries, such as 7th on 6th, the Mercedes-Benz Corporation, and the lovely Angela Linville, to promote women's heart health through the Heart Truth campaign in this Red Dress Project. The Heart Truth campaign includes television, includes radio and print public service advertisements to deliver a wake-up call about women's heart health. The National Heart, Lung, and Blood Institute has produced a brochure on heart disease called the Healthy Heart Handbook for Women. I hope all of you pick it up. It's over here. It's being handed out. We're empowering community leaders to spread the Heart Truth message with a kit that delivers the facts on heart health. We're partnering with advocacy organizations like the American Heart Association, the Sister to Sister Foundation, and Women Heart to get our message out, along with help from the Office of Women's Health here at HHS. And I'd like to introduce Wanda Jones and Vivian Penn, both very active in the women's heart movement here at the department. I thank both of them for being here as well. I'm glad many of these organizations could join us here today. And of course, we have these wonderful red dresses from America's fashion leaders to remind us that beauty isn't just something from the outside. The message of the Red Dress Project is that heart disease doesn't care what you wear. More important than a pretty face and a fine figure is a beautiful heart. And I'm not just talking about a sweet disposition. And if this project can get that message out, if we can save a life and give one mother another day with her daughter, then this whole project will be a success. The good news is that success is easy, and it's within reach of so many American women. Some risk factors, like a family history of early heart disease, are beyond a woman's control, but most can be controlled. Every woman can take steps to reduce her risk and improve her life. Taking up physical activity, quitting cigarettes, no tobacco, or just walking around the block can reduce your risk not just of heart disease, but also of diabetes and other preventable diseases. Take it from me, your heart and your loved ones will thank you for it. Now I certainly have the great privilege of introducing a very good friend and compadre of mine, a wonderful woman leader, Irene Poland, who's the founder and president of the Sister to Sister Foundation. And we've worked together before to get the word out about Hard Truth, and today her foundation is having screenings over at the MCI. So you can go right from here, women, and go over and get screened, and that's the first step. And Irene will tell you more about it. So I'm very proud to be able to have Irene here as one of our dedicated speakers, a dedicated partner, but most of all, just a wonderful good friend. Thank you, Irene.
Thank you so much, Tommy. I also feel very privileged to have you as a friend and a very powerful advocate for this wonderful campaign. I'm just so delighted to be here today to celebrate, as Secretary Thompson said, the first National Women's Heart Day, and at the same time, this Heart Truth campaign, which is very exciting. I hope everybody can see my pin here, which is the symbol of this wonderful campaign. With all of these activities, you know, it's just going to be a fantastic thing, an issue that really needed to come out and will certainly be out there beginning today. But it wasn't easy. I mean, it took a lot of joint efforts, and I am so pleased to tell you about some of the partnerships here. The Department of Health and Human Services, Secretary Thompson, beginning with him. The Offices of Women's Health, Dr. Wanda Jones, my buddy over here, Dr. Vivian Penn from the Office of Women's Health at NIH. The National Heart and Lung Institute, Dr. Lonfon. All of these incredible partners. The American Heart Association now has partnered with us this year. So all of these fantastic, huge, powerful organizations now getting together, and that's how things really happen. By the way, I want to mention, Tommy, that you came to our first opening 2 years ago in the middle of a snowstorm, and you came in and you said, "What's the big deal? I'm from Wisconsin," you know. And so I'm glad to be here today to come through the snowstorm to this event. I'm happy to be here. And I think today really is a turning point, because I think we're opening the eyes of the public of the risk of heart disease in women, and meeting this morning here with thousands of women at this very moment, not only at the MCI Center here, which is just a few blocks away, I hope all of you go down, but also in New York at Madison Square Garden, and in Philadelphia at the Convention Center, and in Chicago at Union Station. So at this very moment, thousands of women are getting screened for heart disease. So I'm extremely pleased to be able to announce that. And I guess a lot of people have asked me, well, why hasn't anybody talked about this before? I've been asked that a lot. Nobody ever talked about it. And why heart disease, and then why women? And I just say, well, why not? Just look at the facts. And I think that's really what got me involved when I discovered that heart disease actually is the #1 killer of women. It takes more lives than the next 10 major diseases, including breast cancer. And unlike so many of the others, it is preventable. And I often quote Dr. Lonfon here on that, because I want to make sure that I'm saying the right thing. So actually, the timing, the whole issue really cannot be more relevant than it is now. We can't begin too soon, or we can't reach out to enough women. This is a tremendous start, this fantastic Hard Truth campaign, all the red dresses that are going to be going around the country. I would like to just throw in one thing that we've learned from our campaign. It's not scientific, but when we just from our own data, and I think it's really an important statement to make, that of all the thousands of women that we saw over a period of 10 days of screenings, most of the women that came didn't think they had a problem. 30% had a problem, and about 3 or 4% had a serious problem. So we really have picked up a lot of problems. So again, I just want to say how happy we are that we're able to expand this. Our goal really is to reach as many people as possible in as many places around the country as we can. I'm going to repeat what everybody else says. Heart disease is the #1 killer of women. One of the things I like to say is that the symptoms for a heart attack are different for a woman than a man, which I've discovered a lot of people don't really know that. But most important, it is preventable. And I think that's one of the reasons I really enjoy working, because there's so many things you can do. And I think that's, once we know what those things are, it really will be preventable. I want to just take this opportunity to thank, again, some of our other partners, including the American Heart Association, our big media sponsor, Bristol Myers Squibb, Women's Day magazine, which really jumped in. They were fantastic. Comcast, which is, I've been getting calls from all over the country, getting the word out. Again, our National Heart and Lung Institute, our offices of Women's Health, and we're just thrilled to really have all these fantastic partners. I really feel that together with this combination of campaigns, that we are making a definite difference for millions of women, that the Hard Truth campaign will definitely make an enormous difference. And for me personally, I find the thrill when I go back and I see people sitting there waiting to get screened. That is worth every bit of hard work that I've ever done. And I'm so pleased to be involved with this. I want to now introduce my cohort here. Dr. Longfoot, are you next speaker here? Yes? Thank you very much, everybody.